Bajan strong and pump it. Pump it up, pump it. Pump it up, pump it. Pump it up, pump it. 'Cause we got the team not winning. Every single body winning. Energy and vibes winning. Winning, winning. Yeah.
Because, my friends, we are Bajan strong.
Hello and welcome to another episode of Bajan Strong. My name is Tahir Bulbulia. I am one of your co-hosts alongside Ambassador Liz Thompson. Unfortunately, her voice is not doing so well. It's the dust in the air, and she's told me to say that it's not from shouting on the platform. But joining me today is two very special guests, two gentlemen I definitely look up to from a young age. Senior lecturer Dr. Kenneth Connell at the Indian Medical Faculty at UWKF. Welcome. And also Ambassador Clyde Mascoll, special advisor to the Minister of Finance. Gentlemen, how are you doing? How's the campaign going for both of you?
Well, the season has been going great. I haven't been doing any campaigning, but certainly I have always been attracted and enjoyed politics. So I look forward to the political season in Barbados.
They call it the silly season.
The silly season, yes.
But I'm glad to see that you're enjoying it. Ambassador, how is it going for you?
I am enjoying myself, but at the constituency level, I like to interact with people in the community.
Nice.
So that's what I'm doing.
Mm-hmm. What are some of those trends that you're seeing within the community? What are people saying? What is the feeling like on the ground?
Well, I think it's just a question of the margin. I don't think there's anything else. There will not be a change in government.
Okay.
Certainly, it's a question of how many people may be willing to go the other way.
Okay, that's good to hear. So this conversation is going to be around economics and NCDs.
Mm-hmm.
They're very closely linked. We know we have an NCD crisis in Barbados and perhaps in the region as well. Dr. Connell, I'm going to start with you. Paint that picture for someone who may not know of the severity of the NCD crisis in Barbados.
So let me just start by saying the NCDs have suffered from what I like to call the gap. Many of you have traveled to the United Kingdom. There are these signs saying, mind the gap as you leave the platform. So think about this. For an infectious disease like COVID or the flu or whatever, it's easy to see getting infected versus getting sick. So you get infected. So for instance, if Clyde had a sore throat here or someone lost their voice and I got infected, then within a few days, I'm going to get sick, right? The NCDs, however, are not like that. The risk factors that we're exposed to often take decades. And so the gap is so wide that it's hard to see the unhealthy eating today causing a stroke in 10 to 20 years. But the crisis is here. And, 4 out of 5 people, 80% of our population, will suffer from NCDs and premature death from NCDs. Now, to put this in perspective, I suppose none of us wants to go out there and get knocked down by a car or even get an infectious disease. So all that we're doing in the NCD crisis is trying to prevent premature death because more than likely, most of us will die from an NCD. And there's several reasons for this, right? One is the NCDs are determined by social behavior, and that's why they're also difficult to address. But I'll hand over to you now.
No, that's very well said. And I think persons really need to truly understand how serious non-communicable diseases are, not just to your body, but also to the economy and to the productivity of the country. So Ambassador, I'm going to come to you now. In terms of the economics, how much on average does government spend a year on battling NCDs and that impact on the hospital as well?
Well, I think that's close to $80 million or so. But the important thing is that it can really affect productivity. And we need, in this country, to be able to work as hard as we can and still enjoy life. And we have to be in a position, therefore, where we can attend work and do what is required to allow this country to get to another level of development. But that's going to come through persons improving the way they do things, doing things better in terms of being far more productive, and also allowing the government to be able to minimize the costs by people over time taking responsibility for their health.
Yeah, definitely a personal responsibility. And if we can really look at it in a chart, health must be at the center of everything. And as you said, we have to get people being more productive in the work. So the impact on labor the impact on education, the impact on young people, and this is impacting a wide cross section. Liz, your thoughts?
Well, I know from a previous life that about 60% of the QEH budget after operating costs really goes to treating chronic non-communicable diseases. Let me ask each of you a question, Dr. Mascoll, if I may. I'd like to start with you and set the context for the national economy. We have the lowest unemployment ever in Barbados at the moment. Our debt, we went in 2018, when the BLP came to government, we were paying 68 cents out of every dollar to repay debt. We are now paying 30 cents out of every dollar. So that tells us the situation has improved considerably. Our debt to GDP ratio was 178.9%. It is now 99%. We had 24 consecutive downgrades under the Democratic Labour Party. We've had 11 consecutive upgrades. Inflation in 2017, at the end of 2017, although everybody talks about prices, was 4.66%. It is today, at the end of 2025, it ranged over the course of 2025 between 0.7 and 1.7%. Talk to me, please, about the state of the Barbados economy. One, and two, there's been what some people might consider an extremely attractive suggestion that VAT should be cut.
Now, let me deal with the debt situation first. So, just like a household, a country borrows based on its ability to pay. The ability to pay of a country is its GDP. So that during that period, the last decade, not only was the debt of Barbados increasing, but the economy was contracting. So as a result of that, the Barbados government at that time was not in a position to service debt the way it ought to. And therefore it was borrowing very heavily, even to pay salaries to the civil service, to pay for transfers of subsidies, interest payment on that, and the like. But what you're having now is that we have not only reduced the amount of debt, but our capacity to pay has increased. So the debt to GDP ratio is really about a capacity to pay, your debt over your ability to pay. The ability to pay has increased and therefore reduced the overall debt to GDP ratio to less than 100. Now, people want to know how something can increase and still fall. It can increase and still fall because it has to do with the fact that we had, before COVID, we had reduced our debt considerably as a result of the restructuring. But then we confronted the reality, and therefore we had to borrow to get back to where we were in terms of being able to deliver services and the like for people. And we did a lot during COVID for people who were not earning. We spent a lot in welfare, a lot in government. In fact, it was then a public sector driven economy. And that what it had to be. It had to be that, because the private sector had contracted. So the long and short of it is that were it not for COVID, we would have already been in transformation phase of work. But because of COVID, that was delayed. The Barbados Economic Recovery and Transformation Program. And as a result of that, we are now in a position where we have in fact reached that below the 100 threshold very quickly, because the economy is also growing.
Dr. Mascoll,
Yes.
put it in simple terms for the average man. Are we better off today
Much better off.
financially? Are we in a worse or better debt situation? That's what people want to know. Because the
course.
narrative has been that the government is borrowing and we are in a very precarious debt position.
No, we can pay. Your ability to pay is what determines whether or not you can borrow, even for an individual. So once the economy is growing, you can afford to borrow. And that is precisely why we are in this position. It's not a question of borrowing without having the capacity to pay. So we are in a far better position. Our foreign reserves are certainly now in the 30-something weeks. Our growth is there. Our unemployment rate is at its lowest ever. And people want to question that. And the notion that you can now seek to attack a governor is wrong.
Yep.
He does not produce the numbers. He uses numbers that are developed by institutions of government, the Barbados Statistical Service, the customs, the BRA, and the like. So he should not be targeted like that for such abuse.
So you're telling me, for the young person listening out there to your question, so you're telling me on the example of the house, we earning more money, so we have a better opportunity to go and borrow. So say for example, we want to buy a car in that house. So my father making some little extra money, my mother making some extra money.
Yes.
I can now go and get a little car loan. I could perhaps go on and put them on a house. So that's what we're saying essentially. That we are earning more money at the top.
Earning more money because the economy is growing.
Lovely.
And the economy is called national income. We call it gross domestic product. You know, economists like to complicate stuff. It's really the national income. And as a consequence of that, because you are in a position where you're earning, you can afford to pay.
Okay.
But you're not just borrowing for willy-nilly purposes. We are now preparing for takeoff in terms of transformation. And that can only occur. A government is different to the household. A government must incur debt in order to be able to provide social services and development for its people. And it is allowed to incur debt. So debt is not a bad thing, is what you do with it. But you certainly cannot incur debt and have a contracting economy as happened between 2008 and 2018.
Dr. Connell, my question to you is, you're on the National Commission
NCD Commission.
for chronic
Non-communicable diseases.
non-communicable diseases.
Yes.
And this manifesto at pages 46 to 48 deals with the issue of NCDs. You've spoken in a very generic way about what a problem it is at the socioeconomic level. Can you take me now to the manifesto provisions and tell me what you think about them, whether they are effective in terms of targeted, what percentage of our population has NCDs, and how will these provisions make a difference, if at all?
Right. So, tackling NCDs, I've always said, although it sounds like a health issue, it's actually not just health at all. It's an all of government response, and it's also an all of society response. And that's what makes it even more challenging. So what attracted me to some of the elements of the manifesto certainly were how it went about or set about kind of addressing a problem that's multisectoral in influence and requiring an all of society response. The first thing you have to know, what's the scale of the problem. You need data, so that decisions need to be driven by data, as we were discussing earlier. So it starts off by saying the use of surveillance and creating technologies to get data in terms of wearables and these sorts of things. Now, why this is attractive is, as you know, we are now in an era of artificial intelligence and big data. Now, think about it. If you could use big data, and using some fancy terms, it's not my area, predictive analytics, which is using all your health data to kind of predict when you might have an incident like a heart attack or a stroke, and intervening, right? So that before you even have, let's say, an asthma attack, imagine getting data using these wearable devices to say that, all right, look, the air quality where you're located has changed. I also have some data showing that your peak flow, which many people listening out there who are asthmatics would know what that is.
Right.
That's also changing. You need to bump up the use of your inhaler. Imagine the impact that has. That person doesn't have to come to an emergency room or even go to their doctor, right? It can then say, well, look, based on your response, your numbers aren't looking any better, I think you need to make an appointment to see your doctor. So it's not waiting until an incident occurs. This is massive, right? Because what it does now is it broadens the health space. Health data isn't only captured in a doctor's office or emergency room. You can see the train coming. I'll use the example in my own specialty. So as a hypertension specialist, I can use a platform to look at when patients' data are changing. And I could see, for instance, when the numbers are going up, and I can say, listen, I know you have an appointment in 3 months' time, but I'm very concerned about your numbers. You need to come in next week. So you don't wait until the person presents with an emergency and clogs the emergency. It's proactive. And this is where medicine is moving. Health informatics and wearable devices. I see mention here of tax exemption for some of these wearable devices, which is brilliant. Now, the next thing that has to be married with this, and I guess this is for the health fraternity listening, we have to accept and use these measurements. As you come to your doctor should be saying to you, well, what were your heart rate logs looking like? Or what were your step rates for the last couple of days? Or some other health data. So these things are important, and these are things that are innovative. Research is important, and the Living Lab is mentioned here. This research is close to my heart on the Hill, and it looks at research into NCD prevention as well as NCD responses.
I want to, if I may, just look at some of the manifesto provisions, and specifically the manifesto speaks to moving from treating illness to building wellness. It speaks about making fruit and vegetables and healthy foods more affordable. And then it definitely engages on a community-based intervention approach. A lot more health nurses and health personnel in the community actually seeing people before they get into crisis. It speaks about building outdoor gyms and wellness spaces, and they're already community-based gyms outdoors, and actually paying personal trainers to go into communities to help people, both old and young, become more fit, more active, more mobile. How will that affect health overall? How will it affect the healthcare system? And will this approach work?
Yeah. So remember, it's important for us to get this right, because 70% of adults in Barbados have at least one NCD.
70%.
Yeah. So that's significant. That's significant burden, right?
70%.
70%. At least one NCD. So this isn't a rare disease.
So people, if you see 10 people in a room, it means that 7 people of those 10 either have heart disease or
hypertension, diabetes, obesity, so one of the non-communicable diseases.
That is what we mean by chronic, severe, non-communicable, another person can't catch it, a disease, something that is staying with you.
There you go.
And that is the chronic non-communicable diseases are the most significant cause of death and disability in Barbados and the Caribbean.
More than 85% of our deaths are NCD related.
Yes.
So that is, again, significant, right? So that's why the interventions are important. Now, to get back to your comment or pointing out the community-based interventions, I sat at a WHO meeting a few years ago. Small and developing countries, it's not that prevention is an option for us. Prevention is really the only option.
Okay.
We can't afford the cure, right? So prevention is really where we have to go. Community-based interventions do just that. It's not just about getting wellness in the community, but it identifies those risk factors for NCDs before a person gets the NCD. So physical inactivity, we know, is a risk factor. What do? You make it easy to move. Whether that's in the community with gyms, you may be like me and you don't like going into a physical gym, but imagine if you could do this in your community with a coach or a gym instructor, or imagine if a group of older people can meet in an exercise group, or by the beach with swimming. So those community-based interactions we know work, and there's evidence that in countries where there's what's known as walkability, for instance, where you can walk to work and those kind of things, people move more. Then there's also the availability of healthy foods. Now, I have to say that one of my criticisms of the manifesto is that it does state that making healthy foods more accessible and more available. One thing I would have wanted to see is how will that be done? Now, there are interventions that do just that. The front of package warning labels is one such intervention, and that's therefore a possibility for us to explore. And I know that the Ministry of Health and Wellness has started that conversation.
Can I interrupt?
Sure, go ahead.
Because we're going to come to the end of this segment, and I wanted quickly to get back to Dr. Mascoll, and then we'll come back and discuss more of the issues that you've been raising. Dr. Mascoll, I want to return to this issue of VAT. Has there been any experience in Barbados with lowering VAT, and has that benefited the public? Because I really want to understand, excuse me, please, the two different approaches that the political parties are taking.
Well, the first thing is public policy must have clarity of purpose. You can't use a reduction in VAT to achieve a reduction in cost of living.
Why not?
Because you're not certain that when you lower the rate, that the business community is going to pass on the benefit to the individual. And that is the issue. And the other thing is that
lower the VAT,
you lower the VAT
but the
rate,
people who are selling the goods just increase their profits
just
by putting
increase my
the money in
profits.
their
Right.
pockets.
The better thing to do, and this comes with time, you can always say, I want to reduce the VAT to 15%. But as you get more information, as you manage an economy, you will know that it is better to pass those benefits on to individuals who are vulnerable. And this is precisely what is happening. The reason is this: because Barbados is a consuming economy as opposed to a producing economy, it is easier to incentivize production. And we did that over the years through fiscal incentives. We brought people here and told them, well, you're going to pay a lower thing, you're going to get interest credits, so you're going to get all these things spaced in order to do manufacturing cheaper. But in this instance, it makes more sense to direct your benefit to the individual as we are doing. We're doing it. One, whenever you introduce a VAT, you have to have a reverse tax credit, because a VAT by nature hurts the small man more than the big man. The reverse tax credit is designed to ease the pressure of the VAT on that group. And therefore, when we came to power in 2018, the reverse tax credit was reduced to $650. And the government increased that back to $1,300.
So the Dems had reduced
Yes,
it
of course.
to $650.
To $650.
And we increased it,
Increased it to $1,300, and now we're
Double.
taking it. Yeah, now we're taking it to $1,700. Not only did we reduce the VAT, the qualification, they increased the reverse tax credit, sorry, but we also increased the income that you qualify for, so that we brought more people into the pool to benefit from the reverse tax credit.
That's a great way to end segment one. You're hearing the experts. Dr. Kenneth Connell, an expert in health. Dr. Clyde Mascoll, an expert in economics. And this is Bajan Strong.
People, represent with your hand in the air.
I am extremely excited about the manifesto as it relates to small business people, because I myself am an entrepreneur, and the trust fund that has helped me tremendously 3 times and not even once. And to imagine that I can now get 4 times the amount, I'm extremely overjoyed, because that means that my business can grow. I can borrow more money, I can buy more rights, and certainly have a better quality of living. Red and ready.
So I would have seen about the breakfast program that is being offered. I think that's a very good initiative, saying that there are so many children that who leave home on mornings not having breakfast. And one of the most greatest benefits of a breakfast is being able to be filled and be able to, have that energy to be able to do schoolwork in the morning time. So that's one of the very good ideas that they came up with for the country. And I'm hoping that people be able to take advantage of the situation and not overdo it.
For you, me, we, and the BLP party.
Welcome back to Bajan Strong, the election podcast of the Barbados Labour Party, where we discuss all the issues of the day, the important ones anyway, with experts in the field. And they've come not out of any partisan consideration, but because of their professional training and their ability to speak to the issues with credibility and authority. Dr. Connell, we resume with you. In the Red Book, as people call it, but it is the Red Record, A to Z, under QEH, it says that $130 million was spent on new equipment or is being spent, 295 clinical posts at a cost of $17 million, increases in nurses in addition to the ones, 160 new nursing posts. All of this went into QEH. And in the manifesto, there is a commitment again to expanding clinical posts, nurses, doctors, other professionals, a $400 million upgrade of the QEH, which includes an expansion that takes the QEH via a bridge over onto what used to be the old Enmore site. For those people of a certain age who remember the Enmore days like Clyde and I would. It then goes on to talk about the way it is going to prioritize mental health and mental health wellness, given the challenges which we are seeing at this time, as well as the refurbishment of the polyclinics and the construction of new polyclinics and taking them to a 24-hour service. My question to you is, with all these posts, with all that money, why are people still complaining about the QEH? What is the challenge? Do you see any improvement at all? Is evidence of this expenditure, is the expenditure evident? But what is the continuing problem?
Yeah. So the QEH, like any tertiary institution, represents the peak of the iceberg, which we described earlier as expanding and is a significant burden, but the part that people see is the peak of the iceberg. And of course, I guess the top of that peak is the emergency department, and always in the news is the long waiting times in the emergency room, the fact that people are waiting sometimes for days to be seen. There are several factors that contribute to this, and maybe the best way is to describe this in terms of a hotel. So when you go to a hotel, ultimately after a long travel, and this could be, how many hours, you want a room, right? You're not really interested in many of the amenities. Yes, you might take them in. You want to get to your room. The lobby of the hotel is really the emergency room. That's where check-in occurs. That's where you have to be seen, you have to be triaged, and you have to go to a room. You can only go to a room.
Triaged?
Determine whether you need to come into the hotel or maybe go somewhere else, your short stay, long stay, who needs to be involved in your stay, those kind of things are happening at triage. The problem there is you need a room, and if there are no rooms available, there's nowhere for you to go. Now, how does that translate into what we see in the emergency room? In order for people in the lobby to be seen, people have to move upstairs. Think about it when you go to a hotel. If everyone's just camped out in the lobby, and no one going to the room, you can't even get into the lobby to get checked in. And this is exactly the problem that occurs. We mentioned the increase in the NCD burden. So more and more people are coming to the hotel because the national NCD burden is increasing, right? You throw on top of that the fact that we are...
The national NCD burden, the number of people in Barbados who have
at least one NCD, which is 70%.
Diabetes, hypertension. Yes.
Right.
Yeah, I'm afraid that sometimes we use language that everybody doesn't get.
Right. So the national burden of people who suffer from sugar, pressure, obesity, those kind of things, is increasing. When you throw on top of that, we are also an aging population. Is anticipated by 2050, 1 out of 2 Barbadians will be 65 years and older. That's significant. You throw on top of that now the recent conversation of an A&E that is saturated in a flu season. So the infectious disease burden now throws on top of that. So you have a lobby that's saturated and a hotel that's really not getting guests out quickly. And secondly, they don't have enough room. There's not enough room in the inn. You can do two things, and both will help you for your rooms. You can even make the system of stay more efficient, getting patients out faster. This comes to the expenditure that you're speaking about in terms of infrastructural changes and more clinical posts and those kind of things. And also improving investigative medicine, such as radiology services, laboratory services, which are spoken to in the manifesto as well. Or you can extend the entire hotel and make more rooms. And I guess this speaks then to the expansion, the 400 million expansion of the QEH, 40% on the Enmore site, which I'm also familiar with. So this is increasing, and it's hard for the average person to say, I don't understand why you have to go to A&E and wait so much time. Is it more doctors? Is it more? That's not the problem. It doesn't matter how many check-in staff you have in the lobby. If people can't get upstairs, people can't get in. You're not going to be seen outside. And to put things in reality, if you have an ambulance coming in with someone on a bed, a stretcher, as Bajans like to call it, that stretcher, now, if there's no bed to put them in the emergency room, they have to stay on the stretcher. That ambulance is out of commission. You see what I mean? An ambulance is only an ambulance if it has a stretcher in it.
So if we deal with NCDs at the community level, reduce the number of people suffering, plus do this expansion, you would expect to see significant improvement.
But those are not occurring in the same timeline. So this is why the manifesto is almost like a two-tier approach. One is speaking to the peak. Let's treat the peak, because these people are sick already. They need to be seen. We can't say wait 20 or 30 years. But the second one is now looking at the expanding iceberg that we can't even see. And that is where the community interventions come in. How do you decrease this iceberg that we don't even see as yet? We know that, for instance, healthcare is expensive. And even training these positions, these new specialists and stuff, is going to cost a lot of money. So these are the things that you have to incorporate if you're going to address the NCD spectrum, as it's called. So from risk factor right up to hospital emergency room is an entire spectrum. You can't have a policy that addresses that spectrum, but you can have several policies affecting different parts of it.
And that's the approach your manifesto takes.
Exactly.
Thank you. Dr. Mascoll, I'm going to ask you a question before I leave you both into his hands, and then I'll come back again, because this segment is going, the time is going. Dr. Mascoll, if I may take you to page 73 of the manifesto, the commitments here are, let me first start with the fact that I noticed in today's paper, there are some economists saying that what the Prime Minister is committing to is not possible. But I remember in 2018, when she said she would increase pensions and give public servants an increase, and she's given them 3. She's increased pensions as well. The same people were saying that it wasn't possible. The country would collapse. The country hasn't collapsed. All our statistics look better. The economy is strong. That was the news coming out today in the Nation newspaper. So now the Prime Minister is saying that she is going to raise the income limit for the compensatory income credit from $35,000 to $50,000. What does that mean for taxpayers? The reverse tax credit will move. We already doubled it from $650 to $1,300. It will move now to $1,700 for people who have.
And you're increasing the qualification to 25.
I'm going to let you explain. For pensioners, they will now get $75,000 tax-free on pensions. And there will be a $1,200 cash payment to pensioners, welfare recipients, and people with special needs grants. Is this doable? Can you talk to me about these these commitments made by the party?
It is extremely doable because of the state of the economy. The economy is growing, the government is getting more revenue, therefore it can afford to spend more. The intention of the compensatory income credit is to ensure that people who earn beneath 50,000 will not pay income tax. But an income tax is an annual tax that you collect on a monthly basis. That is why it's called PAYE. And you need it on
Pay as you earn.
Pay as you earn. And you need it monthly because you have to meet monthly expenses. Therefore, when you offer a credit, that can only be resolved at the end of the year. But the intention here is that persons...
Sorry, I want you to explain. You're talking about being resolved at the end of the year and getting paid monthly, etc.
Yeah.
Does this mean that you still pay your income tax, but you get back the return, or does it mean that
Right.
you just don't pay that money
No,
at all?
in the case of the credit, you submit in order to get back. That's why it's called a credit, as opposed to an allowance. That's why it's called a credit. It's almost what we call below the line. You can only resolve it when you know that the person has earned $50,000 or less.
Okay.
Because I could earn $2,000 this month and only $1,000 next month, and then you're not sure. So by the end of the year, you know precisely whether or not that person qualifies for the,
So
the
if
credit.
at the end of the year, any Barbadian who has made $50,000 or less,
Right.
they would then be entitled to...
A return of any taxes that they will have paid. So that in actual fact, any Barbadian earning less than $50,000 effectively pays no
No
income
tax. No tax.
Yeah, but you can only know that they've paid $50,000 at the end of the year. You with me? That's why you submit to get a credit.
Okay. Okay. Speak to the other provisions, please, particularly ones for pensioners, because this issue...
Let me do the other reverse one.
Sure, please.
Now, what you're doing here as well is that those persons who were previously earning $35,000 or less and who were entitled to the compensatory credit, the benefit for them will now be that they are now going to receive a reverse tax credit of $750 because the fact that you've extended from 35 to 50, they have already benefited. So what do you do for them? You give them $750 rather than the $1,700 that the lower income category is getting. So they too will still benefit, but it will be a proportion of what the lower income persons are getting for the reverse tax credit.
Okay.
Now, pensioners, of which I'm one, what's going to happen here is that you're going to be entitled to a threshold, tax-free threshold now of $75,000.
Like a pensioner.
So, in actual fact, persons in the higher income category as pensioners will benefit from this provision. And this is important because you are targeting the individuals that you want to impact in relation to cost of living.
Gotcha.
If you go and you give each and every person something that they don't deserve, you're not doing what these measures are doing. They're targeting individuals. When it comes now to the cost of living for pensioners, what we're doing here is saying you can get your cost of living benefit either in monthly, quarterly, or an annual tranche, right? So that will assist Barbadians who are already getting pensions from the government, but now you're giving them an additional piece of income in order to be able to take care of any additional cost of living. So again, you cannot fault what is being done here. I do not agree that reducing a value-added tax rate causes a reduction in the cost of living because you're relying on business people to pass on the benefit. And they don't. They've never done it. When they got the reduction in corporate tax rate from 25 to 5.5, they did not do it. When they did not do it.
Yeah.
When they got other benefits in past years, they never did. So you can't rely.
They haven't
on it.
suddenly become generous.
No, they will not. And in all fairness, they're in the business of making profit.
So, ladies and gentlemen, we've come to the end of the second segment. We will be right back.
You in charge, you is the boss. Common crisis, clearing chaos. But in the work, you do the job, and she got my trust. That is enough. Why? Mean you for me. Why? Mean you for we. Why? Running the country firm and steady. I like how me and Molly does represent this country here to the end. Take charge, me you in charge. Pick up me up, giving me confidence and strength. Experience, excellence, and saying take charge, me
A lot of the things that we have done have been started already. And we have a situation where you have a new deal for the disabled, where you have special needs grants, and before the night don't move, you're going to hear more about them. We have a new deal for the elderly. Kirk had a senior citizens bill. It did not make Parliament. He was bringing it the Tuesday, and I dissolved Parliament the Saturday. Sorry, Skipper. We have, and you heard Chantal and Gregory talk about it tonight, a new covenant with our young people. Because we must build a Barbados, and I said so when we became a republic, on this very site in 2021. We must build a Barbados for our young people while taking care of our elderly and others. Because if the young people don't stay, who will lift the weight to build the nation? And therefore, your government has taken a decision that the Water Authority will build out the plan, but it is going to open it up to you, the citizens of Barbados, to own the shares in that desalination plant. So that those of you may be paying water rates, but you can get back dividends from the Water Authority when the day comes. It must come to you because you heard me say the water belongs to who? The people of this country. And therefore, that desal plant will be owned as well between the Water Authority and the people of this country, giving you a decent return on your investment.
for you, me, we, and the BLP party.
Welcome back to the Bajan Strong podcast, and I am pleased to be joined by two special guests, Ambassador Clyde Mascoll and Dr. Kenneth Connell. Ambassador Mascoll, I'm going to come to you. There are certain misconceptions out there, and based on Liz's last question about how is government going to get a lot of these ambitious things done, similar to the rhetoric that was done in 2018. And one of those rhetorics and misconceptions out there is that the Barbados Labour Party government focuses heavily on the big businesses, the big investors coming into the country. But it has done significant work for small enterprises in the country. Can you speak to that and some of those and tackle some of those misconceptions out there as to how we handle the economy?
But that is joke. What is a big business? Yeah. Is it because it is foreign that it's big? No. And there are not a lot of big businesses in Barbados anyhow. In fact, the biggest institutions in Barbados are the UWI and the QEH. The two biggest businesses in Barbados.
And those are public sector.
And they're public sector. And by the way, all of the important social services in Barbados is delivered by the government. Garbage, water, transport, partly
Education.
education, healthcare.
Housing. A lot of the housing.
A lot. So in actual fact, I actually think that the real legacy of our Prime Minister is going to come down to being the first Prime Minister to have tackled the issue of state-owned enterprises inefficiency, because she has the courage to do so. And I actually think that that's going to be the case. But I want to speak to something else. There are two ways in which a government earns money, raises revenue. The best way is for the economy to grow. The alternative to that is to try to force persons to pay more taxes. But when you get growth, for every additional dollar in the Barbados economy, you get about 26 cents out of that as tax, as revenue,
Yeah.
because the GDP growth. So growth is actually what sustains an economy. It does so even at the commercial level in terms of banks. When I get $1 and I spend it, you earn it, you spend it, Liz earns it, and therefore it is through growth that government grows without being parasitic. If there's no growth in the economy, as happened during the last administration, then you are trying to extract revenue from something that is shrinking, which then causes further problems. So what has happened since 2018, except for the period of COVID, is the expansion of the economy naturally gives the government more revenue. And that's what has happened. In addition to that, the government has benefited from the reforms to corporate tax across the world.
Yes.
And that is, in fact, the additional revenue that the government is able now to utilize
Strap.
to make these kind of changes to allow individuals to benefit from the bounty. And the government said quite early, you will have, if you are part of the burden, you will also be part of the bounty. And the bounty is coming by way of the fact that we made the adjustments on the corporate side internationally, and we are now benefiting from that. So there's no lack of ability of the government to deliver on the programs.
Right.
All that happens is that, like a good captain, you wait, you see what your opponent does. Your opponent decides early to come because it seems politically prudent to reduce the VAT. And the Prime Minister pounces and shows that there's a far better way to tackle cost of living by putting money in the hands of the most vulnerable.
Thank you. Dr. Mascoll, I have a question for you, but I also have a question for Dr. Connell. So if you don't mind, I'm going to let him think about his, and then I'll come to you with your question, and then we'll get his answer, and then Tahir will take over. Okay? Great. Dr. Connell, I've been to hospitals outside of Barbados, and there was always a long waiting time in the A&E, and I want you to explain a little bit about what happens and the waiting times that people think are unreasonable. So I want to understand, in terms of the management of an A&E and the waiting times, whether this is reasonable, unreasonable, and I want to hear a little bit more about the QE. So if you can be thinking about that. Dr. Mascoll, my question to you is, there are about 25,000 public servants in Barbados.
Yeah.
And this manifesto at page 44, and you can see the links online here for the red record, which says what the government did from 2018 to 2026, and the manifesto is also available online. So when we came to government, civil servants did not have an increase in 10 years. They've gotten 3 in 8 years. And now the government is promising that 30% of all housing lots and residential lots in properties in government will go to civil servants, that they will deliver continuous training via AI, that if they do courses through NTI, Coursera, and edX, that they will be taken account of for promotion, that the training loan fund will go from 10,000 to 15,000, that those that are eligible for loans, that group will be expanded, and the loan will be $125,000 rather than $100,000, and electric or hybrid vehicles will be $75,000. And if you are a technical expert, you do not have to transfer into the administrative stream to get promotion and increase salary, you can stay within the technical stream. Can you talk to me about these measures, the impact on the economy, how this will impact the public service as well? And then we'll go to Dr. Connell, and we'll come back to Tahir.
Well, this is appropriate. I work with several civil servants because I go around to different departments of government. And what they need is to be incentivized. They must feel as though they're contributing to the development of the country, not just from coming to work, but being part of the process of decision making. And that I have seen already. I can tell you that the compensatory income tax compensatory income credit, was in fact given that name by a civil servant.
Wow.
I'm telling you, I can tell you that the income tax reforms of 2019 was done by some of us in collaboration with the staff of the BRA, and not one thing was leaked. When you give people that kind of responsibility and they feel as though they're part of the process, they feel empowered to do more.
That reminds me, you know something about this. There's a lot of talk that the transport board is going to be sold, that people are going to have to pay bus fare.
Pensioners.
Pensioners will not be free anymore. Sorry to interrupt you, but it just struck me when you said about information not being leaked. That's a big one out there. That's a big rumor. And I know you know what's
that's not going to happen. In fact, all of the persons who currently receive free transport will receive it. Nobody is going to be deprived of what they currently get from the transport system. In fact, it will be enhanced because of the efficiency. Now, we're not selling either.
Okay.
It is a private-public partnership, and it's a lease-to-own relationship. There's no driver who will be offered an opportunity to participate in a public-private partnership that has the capacity to borrow $600,000. Think about it.
What's the significance?
$600,000 is the cost of one of the buses that recently came in.
Okay.
If a government were privatizing the transport board, why would it still bring buses in?
Yeah.
And why would it promise?
Yeah, they just brought in 121.
And why would it promise to bring more? So I can't divulge all the information, but I can tell you that no old age pensioner will be denied or deprived of the right to ride on a bus for free. No policeman, no school child. In fact, I think it's the most wonderful model of enfranchisement that you could want. But in the fullness of time, you will get the full details.
Thank you.
Stay tuned.
Stay tuned. Next time, yes.
Stay tuned for another episode.
Excuse me.
Yeah.
Sorry.
It's okay. We know how it is to
So,
Yeah.
so you know, any waiting times are a pet peeve.
I'm not contagious.
I'll let you know in 2 weeks. So, no, any waiting times are, pet peeve for not just the public, but for us in the medical profession as well. In another life, I actually worked in the UK at St. Thomas's Hospital, where I will be next week, actually. And the waiting times there for patients admitted were anywhere between 12 to 14 hours, right? So not a few hours, 12 to 14 hours. Now there's a UK standard that's trying to get that admission time to less than 6 hours. But still, roughly 40% of patients in an emergency room in the United Kingdom wait at least 4 to 5 hours. Now, in our setting, waiting days is also not appropriate, right? That's not satisfactory. But there's a perception, and this occurs because most of us are interacting with the healthcare facilities, going to your private doctor or going to your GP. You have an appointment, you go. You don't anticipate when you go to the emergency room, this isn't just a collection of GPs.
Right.
This is a set unit that has to prioritize. Remember we spoke about triaging. right? Things that are more severe, less severe, you get a gunshot happening now almost on a nightly basis, then that takes away from the time. So, or extends the time. So there's a perception that I have been waiting here for X amount of hours, therefore I must 3 days. I must. What is happening? It all has to do inherently, interestingly, the way hospitals operate. I'll tell you an example. So if you come to the emergency room, let's say you have a really bad cough, okay? You come to the emergency room, you coughing. Someone outside comes in, they're bleeding. They're going to go ahead of you. It doesn't matter how long you're out there coughing, right? Now, you get seen by the emergency medicine doctor. That's the first doctor is going to see, assess. That doctor is going to do a whole set of investigations. That list of that panel of investigations is increasing. Those results are going to take time. They then have reviewed by the ER doctor, who then needs to make a decision. Which doctor in hospital I need to refer you to? This could be, I use the example of a cough, so I guess that narrows it down to medicine. But suppose it's some other complaint. It might be surgery versus medicine versus, obstetrics, those kind of things. So the clinical teams upstairs have to see you. When the clinical teams see you now, they also need to do more investigations. So again, that prolongs the time. And sometimes that's necessary to decide whether you get admitted or discharged. So that time is adding up. The clock is ticking. And therefore, the public doesn't know that. There's also the perception that you're waiting there and nothing is happening. No. It's because investigation results are coming in so that the best decision can be made. But this is not, of course, to excuse the day's wait. That comes because...
But could there be better communication with patients?
There could be it could be much better communication. And, the one thing that I don't think we've gotten right as a hospital is communicating clearly what's happening. Patient advocate coming and saying to you, listen, we're still waiting on this result to come back. The team is already managing you. Some patients are in the ER already admitted, because remember the medicine team has admitted them, but there's no bed upstairs. They're being treated, and they're still saying no one has seen me. Because they're in the ER, so you could understand if I'm in the emergency room, it means nothing is happening.
Right.
The medicine team is managing, but it's just being managing the space downstairs.
So, ladies and gentlemen, this hour has flew by. And I'm going to open up for your closing comments. February 11th is almost there. Ambassador Mascoll, send a message to those out there, encouraging them to go to the polls on February 11th.
Well, the thing is that you have a responsibility to put your X down. And the truth is that this administration, since 2018, has done a remarkable job in restoring Barbados' pride. We now have to restore Barbados' industry.
Dr. Connell, your message to those out there, encouraging them to go to the polls on February 11th.
I have to say the one thing that I couldn't wait to do as a citizen of this country is to vote. I am very disappointed not being here for election day because I think it's my civic responsibility. I want every Barbadian, regardless of what political party you decide to vote for, to go out there and exercise that right. People have lost their lives to exercise that right, and it's something that should not be taken lightly, especially on people listening to podcasts, because I know you're listening.
So, ladies and gentlemen, we've come to the end of yet another Bajan Strong podcast, and it's been a pleasure to be your host for today's edition. And we had two exceptional men who've charted a path in various spaces across Barbados. Ambassador Clyde Mascoll, who's the advisor to the Minister of Finance, and Dr. Kenneth Connell, who is the lecturer and senior lecturer in clinical pharmacology and therapeutics at UWKville. So, gentlemen, thank you so very much for joining us today on the Bajan Strong podcast. I hope you, the public, enjoyed it. So, from Tahir and
Liz,
see you soon. Goodbye and God bless.
Thank you.
Thank you.
Bajan Strong and Pompeii.